guys, I'm JG the PT, and I'm a clinical support specialist here at NeuFit, and I'm gonna talk you guys through my first session with a post-op ACL patient. I get so many questions about what to do in post-op with our ACLs, how quickly we can implement the Neubie, and where the pads go, and what do you do? So we're gonna talk through it. One of the most important things is implementing the Neubie as quickly as we can. So typically, I will see my patients the first week post-op, and this is what I'm gonna do. This is session 1. We're gonna start right away with the Neubie. What we're gonna do is return neural connection to that knee, to that quad as soon as we possibly can. We've talked about it before, but when we have an injury or a trauma, your brain starts to shut down neural connection to that area. It starts to swell, we get a pain response, and that's what's gonna happen after our surgery. We're gonna get swelling in the knee, they're gonna have some pain there, so we're gonna try and tackle that right away. Our biggest limiters to healing are swelling and pain. So if you can take care of that as quickly as possible with the Neubie, we're already setting our patients up for maximal success. So I'm gonna show you how we first tackle the pain and the swelling. We're gonna take glove work first. So I'm gonna put the ground on my patient's low back, and then I'm gonna use the glove to kind of work through the whole lower extremity. So I'm gonna start down below, I'm gonna work my way into the knee, and then I'm gonna work my way up into the quad to restore neural connection. This is gonna help with swelling and pain. Obviously, I know we're gonna have bandages on this knee. You're just gonna work around them as best as you can. So ground is gonna go on the low back. And then I'm gonna don the glove. Glove is connected to the black, and I'm gonna run the current through my hand. We're on 500 pulses per setting, that 500 hertz frequency. I'm gonna place my hand on her lower leg, and I'm gonna turn up the frequency and the intensity until she can start to feel it. So tell me when you get first sensation. It's gonna feel like tingles through your leg. You feel it. Tell me when it's at like a 5 out of 10. Right there. It's probably gonna feel different on both sides. Yeah. Okay. So as you work through the lower leg, we're gonna work from the lower leg and up because we're working on that swelling. They're probably going to feel the current a little bit more down here than they will once you get into the knee. When you get into the knee, you're probably gonna have to turn up the intensity. Do you feel that?
Yes.
Okay. So as I work through the knee, I'm gonna work on the lateral side, I'm gonna work into the medial side, I'm gonna work behind that knee. I'm just trying to decrease swelling, and I'm trying to get some neural input into that knee. You should see the swelling decrease as you move through this. You can spend around like 5 to 10 minutes around the knee. Then I'm gonna work up into that quad. You're gonna probably elicit some muscle contractions as we get into that quad. Remember, you're probably gonna have to keep turning it up as we go through. Can you feel that?
Mm-hmm.
Do you want me to turn it up?
No.
You feel that on the VMO? We're definitely gonna make sure we hit the VMO and we have connection there. They might get a stronger response out of that. They're also probably gonna get a strong response out of the lateral quad. There's always typically some trigger points in that zone. Okay, there. Overall, I'm probably gonna spend anywhere from 10 to 15 to 20 minutes on the glove work. This is gonna feel good for your patient. It's gonna feel relaxing. You can come all the way down and up, use some effleurage techniques, anything to kind of help with the swelling and the pain. Okay, after you're done with that glove work, we're gonna move on to pad placement on the knee, and we're gonna move through a little bit of active range of motion. So we're gonna take that pad from the low back, and we're gonna take 3 more pads, and we're gonna put 4 pads on the knee. If you're worried about your patient's tolerance, you can always use 2, but I'm gonna show you my favorite pad placement. Okay, I'm gonna take 2 of the rectangular pads, and I'm gonna put them on the bottom of the knee and on the medial side of the knee. So I'm gonna take 1 here, and then I'm gonna take 1 here. Then I'm gonna grab 2 more pads, and I'm gonna put them on the lateral side and on top. I'm kind of framing the knee. Typically, we're gonna have bandages on the knee right after surgery, so you can just work around them. Sometimes it doesn't make a perfect square. Sometimes it's a little bit more on the muscle. That's okay. So we'll take our channel 2 and we'll place this one here. And then we can place the other one on top. Again, you're just working around those bandages, getting as close to the knee as possible. This is here. Now that I have all 4 pads, I'm gonna stay on 500 hertz and I'm gonna turn the intensity up to where she's at a 5 out of 10. She's gonna get a lot of input into the knee. Tell me when. You got a 5 out of 10.
Yeah, that's good.
Okay, so we're gonna be here, we're at 5 out of 10, we're working on blood flow to the knee, we're working on swelling. And then what I like to do is have my patients go through any active range that they can. When they're post-op, sometimes there's a lot of guarding. So instead of me trying to push into extension and me trying to force that flexion, it's a little bit easier if we give our patients control. This is just what's worked best for me in my practice. So if you wanna move straight to that passive, you can. But I'm gonna have the patient try and squeeze their quad and get into extension. So push down into your knee, good, and then relax. I'm gonna have them push into that extension maybe 10 times. Make sure it feels good. We're moving slow. They just had surgery. We're explaining why we need to maintain that extension range of motion and why that's so important to get back immediately post-op. So we're gonna move through that extension. Then I'm gonna have them move through flexion within their post-op protocol, of course. But I'm gonna facilitate that and I'm gonna go under the knee and kind of help them. We're gonna go into that knee flexion. How's that feel? Good. And then back down. I'm gonna have them help me out a lot here. Does that feel good? Did the current go down?
Yeah.
Okay, so as your patient is sitting on the table and you're going through these motions, they're gonna neurologically adapt to the current. We want that to happen because that means that we're increasing neural connection to the knee and we're increasing that blood flow. So if you are asking them, hey, are you still at a 5 out of 10? We need to keep it at that intensity. You're gonna have to most likely keep going up on the Neubie, and remember that's a good thing, and explain that to your patient. So tell me when we're at a 5 again. Okay. All right, give me like 5 more of that flexion. Again, if they're post-op, you can help them out. You can facilitate this. You're gonna be mindful of any protocol restrictions. Maybe it's 90 degrees. Maybe you're just trying to get that first 30 degrees. Does that feel okay?
Mm-hmm.
Great. Okay, I'm gonna have her pause here. Then now, whether you went active range of motion or passive range of motion first, let's flip-flop. So now I would kind of give her a little overpressure into that extension. Then I might give her a little overpressure into that flexion to try and get where I'm trying to, what measurements I'm trying to achieve. If you started with passive, then you can move into active. While these pads are here in this placement, I'm gonna change the current. So we're gonna take the current all the way down to 0 for intensity. And then we're gonna change the frequency and we're gonna go from 500 all the way to 5. This is gonna be that pulsy setting. It's gonna feel like a tapping. It's gonna feel like a heartbeat. This is gonna help with swelling. So I'm gonna tell my patient, we're on a different setting now. It's gonna feel like a little bit of a heartbeat. It's gonna feel like a tapping. I want you to tell me when you start to feel it.
Okay, I can feel it.
Okay, I want you to tell me when you're at a 5 out of 10.
Okay.
Right there. If you are on any part of the muscle, especially with this top one, you're gonna see a little bit of a contraction out of that VMO or the end of that rec fem. So it is normal to see the muscles contract like this. How does this feel?
Good.
This should feel good for the patient. It feels like things are working. It mimics a muscle contraction. So it's helping that muscle pump get the swelling out of your knee. So this is usually a crowd pleaser for the patient and it feels really nice. We can stay here from anywhere to like 5 to 7 minutes, pending your patient tolerance. If they're super sensitive and they have a lot of pain in general, I wouldn't stay here for too long. Maybe put the timer on for 3 minutes. If they can tolerate a little bit more, we can go into that 5 or 7 range. Again, this is your first treatment post-op, so we don't want to overdo anything.